Excuse me?
Doctor, can you hear me?
Yes.
Yes, okay. So let's start now. I'm Dr Ratchathorn from back of Thailand. Good afternoon, everyone. I see many doctors in this room, right? Okay. Today I'm going to talk to you about the hair transplantation and regenerative accident. So today I'm going to have an outline and talk about two things. First, about behind regenerative accident and mechanism of action. And then second, I would like to share my experience when I use tissue micrograft combination with the hair transplantation. So now today, everyone knows about the regenerative accident. I think it is good vaccine that have approved by FDA, also by CE for tissue dissection. It can develop with what we call the micrograft or micro tissue that contain a lot of protein cells. And I have heard about the last speaker that talked to you about the protein cells. This is the first study come from the company that show that regenerative extract contains a lot of protein cells. This study using the fat sorting technique and immunohistochemistry to confirm different type of human tissue that have a protein cells from regenerative activity. When you look at the cell, what we get when we do the cell micro to all hair micrograft or micro tissue. It's composed of three components. The first one is called the infundibulum. The infundibulum part of the part actually we don't need that. In some people that remove it because database we don't need it for the regeneration. But the important part of the hair tissue is first is much part that contains the hair follicle. And the second part is about the hair bulb cells. Hair bulb cells are individual part of the hair follicle that contain the follicle. And the third thing that's important is about the dermis and the fat or adipocyte tissue surrounding the hair follicle, which is have a regenerative property. First, we talk about the hair follicle. Everyone knows that it's located in the hair bulge, and they contain there's fluorescein and high expression of between letter 1, protein 15, protein 19. And we all know that ablation of bulb cells can result in the extraction of the hair. And the second important thing is inductive dermal cells that we call the dermosclerally and dermosheath. I have heard about last paper intention is the dermosclerally one, and this study was done in 1999 and published in Nature, which is the most and the first important study that shows that dermosclerally and dermosheath tissue can induce the hair formation. This study was done by removing the dermosclerally and dermosheath from women and getting plants into the forearm of men. And after that, this induced hair comes. And then they are checked, the genes come from the women. So this can refer that dermosclerally and dermosheath will have a regenerative property. And the important thing is the crosstalk that is called epithelial mesenchymal interaction between the dermosclerally cells and the stem cells is very important for the hair cycle and it's important for the regeneration, especially because the wind and the vacuum. Except for the bulb hair follicle bulb stem cells that including this micrograft tissue suspension, they have the dermosclerally cells and dermosheath cells. And the last thing that's very important, they have adipocyte cells or fat cells. There are a lot of studies that show that fat themselves can stimulate or regenerate the hair. This study was done by doing a liposuction and create pure fat from the top, and then with the injection into the scalp and show improvement in androgen tissue. However, this is an important study that happened in 2017 and show that of all the fat in your body, in or inside the scalp has a high regenerative properties than other animal tissues. So if you want to select the fat from the other parts, it is better to select the fat from the scalp and regenerate the tissue. This finding suggests that the scalp stem cell enriched fat trapping and leads to the promising ability approach to treat the bowel or endocrine alopecia in both men and women. So, in summarize of mechanism of action of this regenerative work. So, at first, this regenerative work was aimed to treat the endocrine alopecia. We all know in the early stage of the AGA, this is what, right? When you are in the early stage, for example, like class 3 vortex in males, when you give them a medication, finasteride or minoxidil, it can regenerate or reversible at the early stage because it has stem cells into the normal. However, in the later the main problem of the AGA is failure to activate existing acids to form a new cycle. So this is very important for the regenerative work to help on this part of the hair follicle or of the cycle. So there are two proposed mechanisms of scalp cell protein. The first one that's called the theory of morphogenesis, which that the triple cells can stimulate the small or baby hair, miniaturization hair, to become a large or to and the second is on the neogenesis, that the tryptophan cells, if you're lucky, it can stimulate the follicular epidermis to create new hair follicles that we call follicular neogenesis. We are increasing the cytokines and important signal, especially the root. So these tryptophan cells will stimulate the existing hair follicles by their chains or reticulate, what we call microenvironment. The microenvironment is an environment surrounding the stem cells in the blood barrier, the muscle cells, and finally they activate stem cells. That is lazy in circulation. So as mentioned the first part and the side of ANC and in the regenerate or self-working of the stem cells, epidermal stem cells in the blood area, and the dermal cells to develop as normal or function as normal. If you have any questions, please feel to ask after this. The second part is about sharing my tweet of using the KMT in the transplantation. We all know that there are two types of transplantation, the technique and technique. And this is a video how I do it. So after you select the graph, I start with the meteor. This is the FDC technique. I use the open technique, so let's traumatize to the graph. And then if you FDT, we get a leftover fat underneath the graph for the regenerative work. And also the dermis and the fat surrounding the graph. And we put the leftover graph and the dermis into the carton. 0.1 per centimeter after size 19. So my tip is using AMT regenerative haircuts, and right now I usually compare regenerative with PRP. In the field I put the normal things, but right now I move to the PRP. The second from the FUT haircut, I prefer big open or big cartridge than a small. And for the FUT, the small one is okay. During the harvesting phase, I usually put a graph in the AMT solution instead of normal solution. I keep the AMT solution after we already get the solution in the refrigerator or over the an ice. As for the certificate, I not use it immediately. But if you use it immediately, if you get the tissue from the FUT transplantation, you get all of the mist and fat tissue get ready to do the process. Please keep it in the temperature about 4 Celsius to make before you make the AMT solution during the process. This is how I combine with the PRP. This is right now, I usually combine the AMT regenerative mixed with the into the stove after I do side making before I start to do the implantation. This is a mixing cell with the So instead of 0.1 per centimeter. Into the deep dermis. This is a new cartridge that approved for FUT. It's the big one. So you get a thicker. You can see it's very thick. It's a solution that contains a lot of the mist and fat stem cells. It's very good for regeneration. So the possible benefit of regenerative technology for the hair transplantation: first, to make it increase tuberculosis. The second is help to regenerate hair in areas where the hair transplantation is not proven. This is a sample of the patient before and after hair transplantation in combination with the regenerative. You can see a lot of improvement. This is after 3,000 grafts with a big change for the patient. This guy has been done this technique, FUT technique once many years, and I do the FUT technique another benefit is using regenerative in female skin health who need hair transplant. In women, which is very important because in the women, most of them is miniaturization. So I think for the women, regenerative is not for them. And also, in some patients, also increase shorter the fusion phase after the hair transplantation. This is a man before and after the treatment. This time I do the hair transplantation in the frontal area, but at the back area or the top area I do the regenerative. You can see the improvement at the top area. That this is from the regenerative, not from the hair transplantation. And the same at this time I do the hair transplantation just over in the front up to here, but overall hair improvement. I think some parts of them because of regenerative. Also this time I do transplant frontal part and some on the front, but overall you can see the hair thickness increase. I think it's because of the regeneration. This is another time I do the hair transplant, mostly at the front, at the back, and overall it's increased in hair thickness. This is the same size as the frontal loop. So it's very helpful in regenerating hair in the area where not hair transplant, where hair transplantation not performed. So in female pattern hair loss, I think it's quite important. This is an example of the patient before and after FUT hair transplantation. This is another patient before and 11 months after the FUT hair transplantation. This is FUT hair transplantation, 1,600 grafts. This is another woman, 2,400 grafts, filling in the frontal area of the patient in combination with the AMT hair transplantation. This is also another patient. So another benefit of regenerative is they decrease the risk of skin fragmentosis after hair transplant in the bigger section. I think in the patient who has a risk of necrosis, for example, like heavy smoking or have a scarring of the shear, and we would like to do the hair transplantation once, it is better to combine regenerative with hair transplantation. And I see in some patients there are rapid healing of the transplanted wound with a less fibrosis posture. This is another example of the advantage of the regenerative that I think it can shorten fusion phase after the hair transplantation. That means I see the rapid growth of the hair after the hair transplantation. This is only 3 months after hair transplantation. I see a lot of hair coming. Mostly after the hair transplantation, hair coming at 4 months. This is 3 months, very big change. This is another patient. At 4 months, you can see very big change in this cell after FUT hair transplantation with the regenerative one. But at 8 months, it's increasing. So I think it's faster than normal people, than normal hair transplantation. When you combine FUT with the regenerative. The same patient at 4 months, you can see the new hair coming so fast. At 8 months, the hair coming very slowly. This is another patient at 4 months. You can see 4 months, the patient starts to have a full head of hair. This is a starting of issue in the patient who has this patient has a fractional alopecia, developed starting alopecia. In this movement, I combine the FUT hair transplantation with the regenerative to help decrease the risk of the necrosis and increase the scar survival in the patients who have a starting alopecia. This is 6 months after the 2,000 grafts FUT hair transplantation. some patients who have a cell left, I also project into that or at the start. As you can see, only 5 days, the wound or FUT wound is almost healed. So this is faster in the healing process of the hair transplantation. And the wound is difficult to detect after treatment. So in conclusion, from my experience, like almost 8 to 10 years, I think regenerative work is effective and promising results in the multi-moderate majority of cases individual or in combination with a laser or mechanism. And it is also the good option when in combination with the hair transplantation. To me, it is quite safe because the tissue discretion process is created by mechanical process, not a chemical process. However, further randomized control trials to see the clinical study and mechanism of action or viability of self-suspension are very needed in the future. So thank you for your attention.
Thank you, Dr. Ratchathorn. Thank you again for your wonderful sharing. Hope we can see you soon in Taiwan.